muscular lesion, which I find so often present in people with lower back problems. And we are talking here of the piriformis muscle, a deep muscle beneath the gluteals that goes from the lateral aspect of the sacrum into the femur, the trochanter of the femur. And this muscle, very often, it contracts. And with most clients or patients, when you push down in this area where the piriformis moves, you very often will find that the person is in pain. But one thing I like to mention here, that in my experience, very seldom you'll find that there is a piriformis problem on its own. Very often the piriformis problem comes with a subluxation of the pelvic area. And so it gets tense. Or tightened, you know, to try to stop movement within the pelvic area to protect it. So very often, if you make contact in this region, as I said, you'll find a tight piriformis. And it's very important to treat it individually, because even if you treat the lumbar or pelvic problem, very often the piriformis does not relax automatically, but it remains. Then the tip of the femur, and more or less on that line, halfway, you will find the trigger point. So you can either work on the trigger point with your thumb, just massaging gently, and as the person gets accustomed to the touch and it's not too painful, you go gently with your rotation, you go a bit deeper. So the important point, you see, because I could easily demonstrate, oh, you just massaging this area, but there are some points which are very important, and that is you don't go whack all the way down really deep, because the person is just going to jump on the plinth. So you do it, I believe that by gentle coaxing, you can get anywhere you like. Sometimes it works in life as well, something like this, not always. And so you gently press in a way that it is not painful or uncomfortable, Once the area is nicely relaxed, then you go just a little bit deeper. Make sure you yourself you're nicely grounded, your shoulders relax, you are breathing from your belly, okay? So you communicate that sense of relaxation. And you go deeper and you relax the area till the contracture releases. You can also go with your knuckles in this fashion, with the middle knuckle like this. That is also quite effective, and you create this kind of vibrating movement. Again, you can go deeper and deeper. And as well, a favorite massage technique of many is with the elbow. Again, you go there, okay? Extend and flex the elbow and gently go there. It actually should be relaxing and releasing for the person. They might at first feel a little bit of discomfort, but soon after they should feel a sense of well-being coming from this technique. That's important. So these are some good techniques, and then you can also stretch a little bit in that position, in that direction, following the fibers of the muscle. Okay, and after seeing these techniques, we are going to look at some muscle energies, techniques to decontract the muscle, and they are very effective.